In this series of brief chats, we're talking about equity in clinical medicine, the lack of which is a situation that too many Americans face. With me is Dr. Kimberly Manning, a professor of medicine at Emory, where she serves as Associate Vice Chair of Diversity, Equity, and Inclusion, or DEI. And she tweets. Boy, does she tweet. Welcome, Dr. Manning.
Oh, thank you for having me. Joe, I'll tell you a quick story, if you don't mind.
Love stories.
Okay, so I had a resident on my team a few years ago who was from Mexico City, and this particular day we happened to be rounding on my birthday, and he said to me, he said, "Oh, you know, we need to sing you Las Mañanitas," and I said, "I don't know what that is," and he's like, "You never heard that song? That's the song people sing you in the morning on your birthday." In Mexico or in Latin America. Well, I'm not from Mexico or Latin America. I'd never heard that before. So he took out his phone, he played Las Mañanitas for me, and we talked all about it. Of course, me being a nerd, I looked it all up, and that was that. We finished the month, 2 or 3 years passed. I was on service caring for a patient who had advanced metastatic cancer. And she was a woman who was from Mexico, and she was Spanish speaking only. And it just so happened that she was going to end up being in the hospital on her birthday. She was really upset about it because it was a milestone birthday. And it just so happens it was 2 days before my birthday. So through the interpreter, I'm talking to her about her birthday coming up. She was very sad about it. Sad about her diagnosis. And it was really nothing I could do at this point. We were going to get her to hospice. We had the palliative care team working with us. You know, our wonderful interpreters at Grady have really taught me how to connect with our patients through interpreters. And as we keep talking, I just feel so bad. There's nothing I can do. So on her birthday, I went and bought a balloon from the gift shop, and I came up with the balloon and with the interpreter, gave it to her. And then I said, "I have one more surprise for you." And I took out my phone and I played Las Mañanitas. And the way that that woman cried, I mean, she cried, her whole family cried. They couldn't believe it. Like, here comes this Black woman in Atlanta, Georgia, playing Las Mañanitas. And I would never have known what that was if it had not been, you know, for Alfonso, my intern, those years before. And that, to me, underscores a case for diversity. That patient felt seen. She felt, she felt valued. She felt comforted in that moment. Her whole family felt comforted. And, it's even the most special part about it is 2 days later, I was coming into the hospital and I got paged to come to the floor because the nurses needed me. And when I got up there, it was a card and 2 big balloons, a 4 and an 8, for my 48th birthday from her. And in this perfect cursive that you can tell she had like written it out from Google Translate, because it was kind of, the English was a little off. But she had written a message to me thanking me. And I connected with this patient, and I never, if I would not have had that Mexican resident on my team who just told me this one thing and brought in my life lens in this fleeting moment, it then stayed in my heart, right? And it was something that I could come back and give to my patient and say, "No, I know I'm talking to you through an interpreter. I do. I know that. I know that you have this bad diagnosis. And look, I don't have the panacea for that, but I can see you. I can be with you. I can honor the fact that this is the day you were born. And I can show your family that I'm culturally humble enough, to take what I learned from somebody else and bring it to you today and show you that." It was just like, man, you know what? This is why you cannot have everybody on the team in your hospital looking the same way.
I can't imagine a better way to end our chat, Dr. Manning. And I want to thank you very much for your time and for your stories today.
Thank you for listening.